Thank you guys for carving some time out of your busy days. I mean, obviously, these days are different than any other time in history, and I can't thank you enough for allowing me to enter into your life for a minute. I want to thank, first off, Assisi Animal Health for actually being bold enough to put this kind of content out. This is a conversation that I really wish that a veterinarian had had with me 30 years ago. I was really fortunate early in my career to be exposed to a group of mentors who taught me concepts like we're going to discuss today. And it really propelled my career in a trajectory that I could not have really ever imagined possible. And so I hope to share a little bit of my wisdom and experiences along the way. You know, certainly I've been in practice a long time. I graduated in 1992, and I almost immediately opened my first clinic the following year, within a year. And so, I think some of these concepts will sort of validate my choices in life. And again, if you have questions, we do have a Q&A section here, and I'm going to ask the Assisi Animal Health moderators to sort of put those up there. I have the Q&A panel up so I can see that. So if you have questions, put them up there. We'll be glad to get to them. Again, this is a conversation that we want to have. Please stay in touch. If you have questions, reach out to me. I'm posting lots of different content all over, but a lot of it centers around health and wellness and some of my own personal initiatives. So if you check me out on Instagram, Facebook, Twitter, I guess I'm most active these days on Instagram and YouTube, but definitely follow me there. I have a weekly podcast, the Veterinary Viewfinder, which is the top veterinary podcast in the country, and now coming up in the world. So if you're interested in that kind of content, I encourage you to go to the podcast player of your choice. Check out the Veterinary Viewfinder. This week's episode just drops every Wednesday. We are 201 episodes in, if you can believe that, making us one of the, if not the longest running veterinary focused podcast. 201 consecutive weeks we've been putting out content. So definitely check it out there. But today we really want to focus on this concept of becoming a specialized veterinary generalist. And we'll get into that later. We want to talk about, why it is so critical, essential for us to remain open-minded and analytical when we're making those diagnostic and treatment decisions. I'm going to discuss some of those cognitive biases that can sometimes derail our best thoughts and really prevent us from being the best practitioners that we should do. We can be. I want to talk about this specialized generalist theory. It's gaining more traction around, certainly in leadership circles, but I want to expose you to some of those tenets and somehow that, it might be able to help you. And then I'm going to, briefly try to share with you some of the daily practices that I do, to sort of stay focused and stay in a constant state of creativity and innovation. I mean, and it does begin with getting up early, going to bed, very early as well, exercise, cold therapy as well. So maybe we'll talk about some of that as we move down. So let's kind of jump into it. I want to start by just explaining, or I guess revisiting and reminding us about the history of our profession, because we're a very interesting profession amongst all the other medical and healing arts. The first known vet practice really was about 9,000 years ago, according to archaeological records in the Middle East. And as you probably guess, we were there to take care of herding animals, the food animals, any type of animal, beast of burden. So there was a person designated to sort of take care of them. And that later became known as what we are today as a veterinarian. But it took about 10,000 years before we actually got a veterinary school. Now, this is significant because human medicine was evolving, adapting, emerging thousands and thousands of years before veterinary medicine was formally recognized. And it wasn't until the mid-1700s in France that Claude Bourgelat in Lyon, and of course, if you know anybody who went to the veterinary school in Lyon, they will be very quick to point out it was the first veterinary school in the world, and they should be proud of that. But it was really founded because Bourgelat was the Pope. Just a quick little tangent here. The Pope was so worried about rinderpest. Rinderpest was devastating economies all around the world, and he knew that this was affecting poor people and rich people, and quite frankly, the coffers of the Catholic Church at the time. And so they put together finances to try to eradicate rinderpest, and Bourgelat was put in charge of that. It actually took 250 years before we as humanity did eradicate rinderpest. When I was in veterinary school, we were taught all about rinderpest because obviously it still had 20 more years before it would be eradicated. And interestingly enough, Bourgelat wound up on a French postage stamp. So there's that. But it wasn't then another 100 years almost, well, 50, 60 years before the first graduate veterinarian to come to the US. Now, I want you to think about this history, okay? Here we are, you know, a country, we've already signed the Constitution, we've declared our independence. I mean, and there's still no veterinarians, right? There's just people that sort of do this stuff. And again, these are just critical things to keep in mind as we look at our profession and where it's headed and really where it's been. The first vet school didn't come till 1857. Of course, all the people in Cornell will tell you that they are really the first one because the New York College of Veterinary Surgeons was closed down. Cornell, of course, was next in 1868, and my alma mater was in 1918. And again, just putting it in perspective, the veterinary school that I am proud to call my alma mater is only what, you know, I mean, we're 100 years old. So this is kind of young. The oldest vet clinic in the US started in 1844. Of course, it was primarily for horses at the time, but being in Detroit, as soon as the mechanized horse cart came along, known as the automobile, they began to transition from horses and farm animals into dogs and cats. And I do want to kind of point out, I do want to kind of point out here that there was really quite an innovative veterinarian in LA. Dr. Biles is kind of known as one of the first people to say, I'm a dog or cat specialist, because up until that time, again, veterinarians treated all species, all manners of critters, and Biles was one of the first people to sort of define what we think of today as small animal practice. And even if you look at the language and the messaging that he was using, you know, at this turn of the century, he was saying the operating room is white with the principles of sterilization are similar to anything you'd find at a human hospital. How many times have we as veterinary colleagues used that exact terminology, right? It's just like you'd see at a human hospital, same surgical operations, same anesthetics. I mean, so it's really fascinating to me that there was a person like Biles in LA, turn of the century, who really grasped this and, quite frankly, I think set the template for what I and many of you do today. So I think it's fascinating. And then if we kind of, again, look at, so what is modern small animal veterinary medicine? Biles aside, you know, really we're even newer than 1761 as the first, you know, vet school in the world, and in the mid 1800s for the US. It really has to do with vaccines, and I'll explain why. In 1885, the first human rabies vaccine came up. Of course, the famous Chilean scientists developed this technology where we could rapidly deploy it. Remember, this is interesting. It's also around the time of the Mexico Olympics, Mexico City Olympics. And so many people, you know, were really concerned about outbreaks of rabies and sending their athletes and contingencies to there. And so there was a big push. So it's just a fascinating story about how this rapidly deployed, commercially available vaccine. And I think there are lessons to be learned today as we sort of ramp up our coronavirus vaccine. But remember that you can't, it's not just making a vaccine, it's actually being able to deploy it at scale, at cost, stable, and of course in a safe and effective fashion. And then, you know, so if you kind of think about that, so rabies is percolating along. 54, they kind of have the first rabies vaccine. And then we are still not a real profession, right? It wasn't until the 50s and 60s that veterinary specialists came on board. In fact, it was only in 1950 that the AVMA board of directors received a petition from the pathologists and the public health veterinarians to say, look, we want to be specialists. And they were doing this under increasing public pressure, public meaning really governmental agencies, to say, hey, you know, we need a veterinary voice in zoonotic or public disease outbreaks. And yet the human, you know, medical establishment was saying, there's no pathologists, there's no preventive medicine people. I mean, you're just vets. And it was really important that we establish ourselves as specialists to, again, become part of the conversation, especially in public health. And in 51, they approved that. Now, I just want to then briefly discuss, it wasn't until parvovirus came on the scene that I've long made this argument. I've written multiple articles around, you know, how did we get to where we are today? And it really wasn't until parvovirus came along that suddenly there was this disease. Now, distemper arguably had come before, but the vaccine wasn't widely deployed. Even in England, where it was developed, it really didn't make its way over to the US, and it didn't make the impact that everybody thought that it would, and probably probably should have. It was parvovirus that really sparked it. And I think there's a combination of events there. Certainly the bond was being elevated in the mid to late 1970s. Now we have this disease that's really quite spectacular in terms of media coverage, because these dogs, died these bloody, horrible deaths. And so suddenly there was a vaccine that can actually help for it. Again, getting back to our colleagues at Cornell, 1868 was the second vet school. They are so proud to say, hey, we're the guys that solved the parvo dilemma, and good on them, because they did. It wasn't until 81. And this is the period, I think, I often call this is the birth or origin of small animal practice, because now suddenly people had a reason to see a veterinarian to take care of their dog who was becoming a member of their family. And yet, there was this disease that was hidden out there that would cause a devastating death. And the reason I spend a few minutes here setting this up is because I want you to keep in mind, we're young. We have a generalist legacy. It wasn't until 1951 that the first veterinary specialist actually was even allowed. And then they had to do a couple of years later before they actually seated their first diplomats. So we need to keep an open mind about what I'm going to say. And I'll tell you, I've given this presentation, a couple of times over the past few years. And I have a caveat. I don't know that I would give this exact presentation 20 years from now, because I think we are heading quickly towards, as I've written about, hyper specialization. I think that we actually will probably overshoot the need for veterinary specialists and probably look a lot like human medical specialists today, which means that, oh, you've got a sore throat, we need to go see, a nose and throat specialist. And I don't think that always serves the public good or actually serves patients with medical conditions as well. I do believe, as generalist, as a gatekeeper, as sort of the retainer or reservoir of all knowledge. So I am a strong believer in generalist, but having said that, I think the future is pretty clear that we will become more and more specialized, calling what I call hyper specialization. And this open-mindedness, I'm going to keep going back to this concept. If you want to be an effective person, practitioner, spouse, loved one, really being open-minded is critical. And I think in today's, highly polarized, contentious society, it's hard to be open-minded. I mean, I think now we are really rewarded and maybe even incentivized to be more polarizing. And I don't think that serves humanity. So again, we want to make sure that we're keeping open-minded. But part of this open-mindedness is understanding how we make those decisions, become polarized or not, and how we can then maybe grasp a little control back. And I want you to understand that when we look at some of these psychological tenets, number one, a lot of these are gross estimates, and some research might say a certain number and others have a certain number, but we understand that they're basically general. And right now, psychologists generally agree upon that humans make about 35,000 active decisions every day. And these are many tiny, almost imperceptible. And we're going to use the term unconscious in just a minute, but I need to put that in context and give a very specific definition there. But these are decisions that you're constantly making: what you chose to wear, what you choose to eat, how you choose to move your body, who you choose to interact with, what you choose to interact with them. I mean, these are very complex things, and there's just a churn, a constant assault of really, tough decisions that we're having to make that impact how you feel at the end of the day, and also what you're accomplishing or not. The majority, though, as I mentioned here, are what we would call subconscious. And let's kind of talk about this, because there's been, over the last 20 years in particular, and really over the last 50 years, there's been a lot of research and a lot of discussion around what is the subconscious state? Is that the same as an unconscious state? And so, we've tried to really develop some terminology that would help us explain and communicate more clearly what we're discussing. And so today we're going to be using sort of this new definition of the subconscious, which most psychologists agree upon, the term adaptive unconsciousness. And we're going to talk about the three main, theories right now, but it was primarily done because people were saying Freudian unconsciousness. So prior, especially, prior to 20 years ago, when people would say unconsciousness, it just automatically linked into this concept of Freudian unconsciousness, and they wanted to distinguish it as something different and separate from. And I think you'll understand why when I show you this from Reeves' paper. If we look at sort of where we are today, and we look at the three primary sort of concepts of the unconscious mind. Of course, and again, these are not exclusive. These are all part of the discussion. So it's not that this one is correct and this one is incorrect. No, this is a very fluid dynamic state, and you would use these terms to describe different aspects at different times. But again, we're going to be discussing primarily here today. The Freudian unconsciousness, that's the one where, it's based on your memories, your life experiences. These are all shaping, unknown to you, how you act or behave or respond to a given environmental stimuli. Okay, so, Freudian was all baked into, many things that happened to you as a very young child, even in the womb and during the first year of life. So he really had that theory down. We then started to migrate towards the adaptive unconsciousness, which actually is a much more, I guess, robust and executive level decision making. So basically, and people even use things like in linguistics terminology, they say we're trying to make networks of association. So these are kind of like memories, but they're actually thoughts and impressions and experiences that you've had, and they help you make judgments. They really, there's not a lot of flexibility here. They're very, very fast, which we're going to discuss in just a second, but they allow us to make, and so some heuristics are based on adaptive unconsciousness. So again, shortcuts for the unconscious mind to sort of make sure that, you avoid danger or get the desired outcome. I know this is sounding a little jargony, but just bear with me for a second, because we're going to bring it back home in just a second. And then finally, you'll probably read a lot about implicit motivation. Some of the benchmark papers came out in the late to mid 50s. And really, when we look at implicit motivation, this is when people talk about, intimacy. This is when people talk about, power, right? So these are those things that motivate you to do things. Now, you may not be conscious that you are making a particular movement or behavior to seek more intimacy or more power or prestige, but that's actually the implicit part of that motivation. But let's get into some of the cool new neuroscience of this. The adaptive unconscious, again, we're going to kind of link into that newer definition. We believe now that you're processing about 400 billion bits of information per second. Now that is staggering amount, but this is everything from the current barometric pressure that my body perceives, the sensation and pressure that I feel on my feet or my bottom as I'm seated here, right? My rate of speaking, it's controlling my heart rate and how quickly I breathe, right? The expressions in my face, there's just so many things happening around us that keep us going. And what really psychologists and neuroscientists are starting to understand is that, wow, every one of those things, the pressure on the soles of my feet right now, or how comfortable I am in my chair, can then influence other things, right? It's not that they're done in isolation. Oh, well, I'm uncomfortable in a chair, therefore I'm still maintaining a positive attitude. In fact, as you can probably already just logically conclude, wow, if I'm in an uncomfortable chair for too long, I might get cranky. And these are sort of those connections, those networks of association, those billions of bits of information that do finally manifest themselves in your current attitude and actions. Now compare that to the conscious bandwidth. And right now, again, we're using these terms bandwidth because that's how information is processed. And of course, these have their origins in computing. But when we look at your consciousness, what you're able to take in, it's about 120 bits per second. So the sights and sounds that you can consciously perceive, the flavors, the sensations, all those things that you are aware of in the present, that's a real small bandwidth. And in fact, about half of that bandwidth, about 60 BPS, is just for speech comprehension. Now, this is one of the reasons why you hear people like me and others for the past 20 years going, man, this whole multitasking, I'm a failure at this. Maybe I'm just not smart enough. But what we were actually tuning into was that we didn't have the bandwidth. Nobody does. And this is why multitasking ultimately fails at something, because you're not able to comprehend speech or visual stimuli. You can't do multiple things because that bandwidth is pretty finite. 120, again, versus this adaptive unconsciousness. And I just wanted to kind of, point out one more definition here, because I know sometimes we don't like to get bogged down. We're not psychologists. I'm not a psychologist. I'm a veterinarian. But this is something that I do study intensely, and I've gone to lots and lots of different educational opportunities over the last 30 years to try to improve my being and my performance, if you will. And you keep coming back to these terminologies. Again, unconscious mental processes that influence our judgment and our decisions. It's faster, without any effort, more focused on the present, but the problem is you can't change it. And we'll kind of, I know I did a presentation or a lecture, I guess I did an article in the NAVC, Today's Veterinary Business, a couple of years back where I described this in detail of why it's so hard sometimes to change those clients' impressions of your clinic. So if they have a bad experience, even if they've been with you for 20 years, you can really derail the relationship. Okay. Now, as we sort of now park that one back in your unconsciousness, I want us to discuss the cognitive biases, I think, that sometimes really do limit us in the exam room, of course, in our real life as well. But everybody exhibits cognitive bias. And I think that when medical professionals start to say, not me, of course, we're going to talk about that specific type of cognitive bias in just a second, but that's really, it's not just dangerous, it's doing a disservice to the patient. Because when we say that we are somehow immune to all of these, I mean, golly, these charts continue to expand when we discuss these biases, because remember, these biases, as I mentioned before, that adaptive unconsciousness, it's faster, it's effortless, but it's ultimately less flexible. See, that's the foundation of a cognitive bias. It's hard to change. It's hard to overcome it. This is why so many people will say to you about a political party, for example, or a certain belief system, they are very dogmatic and stubborn toward it, because they're just, it is so hardwired into them that, again, it's a bias that they have a hard time overcoming, and they can't explain it because, right, it's built on all these experiences, feelings, these networks of association. So these are things that are hard to unwind and rewire, quite frankly. And now that leads us into our discussion about really the biggest failing in the clinic. And years ago, I guess it's probably 15 years ago, I first started describing this in lectures as don't fall for the 10-foot diagnosis. And if you're watching from a place that uses meters, that's like 3 meters, okay? But it doesn't sound as good, and I'm an American. So the 10-foot diagnosis was something that I began to witness early in my career other colleagues and associate veterinarians make. And basically, they were making these diagnoses and completely biasing the rest of their exams, therapeutics, follow-ups, and so forth, because they were falling into mental traps, a heuristic, to sort of speed up the process. And, I remember when I first lectured on this, I had an older veterinarian come and goes, Ernie, I'm going to be honest with you. I don't buy any of that malarkey. He goes, if I'm going to be right 80% of the time, I'm fine with this. And it's hard to argue against that. The problem is when you're wrong. And the problem is, are you actually giving your best when you do take these heuristic shortcuts to sort of, overlook and ignore the other things? And, I get it. We're busy, sometimes even feeling overwhelmed, but I think we owe it to our patients to try to overcome these implicit biases. And so I have to respectfully disagree with a colleague who says, hey man, if I'm getting it right 80% of the time, I'm not going to worry about the other 20%. I'm going to be, there's a lot of things in life where the Pareto principle really applies. I don't know in the management of my patients if that's what I'm going to go with. So that's just me. But the 10-foot diagnosis, it kind of goes like this. Okay, you look at your schedule. There is, just for sake of example, just a common one that I just saw that we all have to encounter is it's a Cocker Spaniel, 4-year-old dog. You've seen it a few times for ear infection. Okay, now already I've activated networks of association, neural networks in your mind watching it today. Most of you have already gone to a conclusion. Now, just reflect on that for a second. The minute I started drawing up that imagery, it's a youngish adult Cocker Spaniel, already you're lighting up because that heuristic was applied and you went straight to the ears. Guarantee you the majority of you watching this went straight for ears. Cocker Spaniel, adult, coming in for an appointment. Right, and you're right? Because your brain, the adaptive unconscious is saying, get to the point, dude. Come on, we got to get this over with, right? Because it is trying to become efficient, effortless, right? That's what it's trying to do, but it's less flexible because now it's locked you into something. It's locked you into ears, and you're thinking chronic yeast otitis, right? Or maybe bacterial otitis, but you're thinking chronic ear infection, right? And so this is where the danger of cognitive bias comes in. And if we start to unravel that a little bit, what I just said, that simple statement of looking at the schedule, you see a 3-4-year-old Cocker Spaniel coming in, you've seen it a couple of times for ears, right? You've already jumped to a very specific, quite frankly, diagnosis. Probably most of you said yeast otitis. And you may be right. You may be right 80% of the time. But the first thing that we want to talk about, probably what got most of us trapped there, was the anchoring bias. Okay. And you've heard about the anchoring, but it's our tendency to rely too heavily on the first piece of information offered, right? Cocker Spaniel, ear. So at that point, we then latched on to a pathway, and we're not getting off of that until you prove otherwise. It's going to be a yeast otitis externa until proven otherwise. And that's really the danger, because we can then exclude other really salient information, right? Because we walk into that room, as I always say, primed for whatever we're expecting. So when your expectations are leaning towards something, you've tipped now towards yeast otitis externa and this thing, you may miss a heart murmur. You could miss, a tumor on the underside. And you go, wait, Ernie, I'm going to do a thorough exam. That's where biases start to really fail us, because what happens is all of your brain power, conscious and unconscious, quite frankly, becomes very focused on really confirming, which we're going to talk about in just a second, on confirming that initial impression belief bias, right? So this is why when you say you can do a very thorough exam, if you've already been subjectively biased, by definition, you are no longer objective in the case. And I know this is sounding kind of jargony, but it's important to expose ourselves to these concepts, because I think that, people always talk about the power of vulnerability. Well, see, what I'm laying out right now is the actual true vulnerability of a veterinary practitioner. Now, reflect on that one for a second, right? All this other stuff is a little bit of kind of noise. It definitely is real. But when it comes to patient care, diagnosing, treatment, follow-up, successful outcomes, what I've just said, that's the vulnerability, right? It's like going, maybe we're not as open-minded as we need to be. Maybe we're not as objective in our assessments as we should be. Okay, just throwing it out there. The availability heuristic. Now, this is the second. So you've anchored in, right? So now you've like the first bit of information, Cocker Spaniel, adult, ears, right? And maybe even you latched onto that a little bit. We've seen it before, right? So it's like, okay, well, of course, I know what it is, right? It's that 10-foot diagnosis. But now what happens with this is we've narrowed everything into the most recent, and again, you can use the most extreme, and so sometimes people tend to they bring in too much drama. So suddenly now they just read on TV that there's a new infection going around, and they have a headache the next day that's completely unrelated to whatever this condition is, but suddenly like, oh my gosh, I have Ebola, right? So, I mean, we all know people like that, but that is the availability heuristic, and that's just the latest, most extreme thing. But for us, I think it's more of the recent, the most frequent, right? I always talk about, in terms of availability heuristics, as saying, what do we see most commonly? It's just like that vet that I described earlier, who said, if I'm going to be right 80% of the time, AKA the availability is frequent here for otitis externa in this example, then I'm going to go for it. And again, yeah, it's a shortcut. A heuristic is simply a mental shortcut to try to get you there. And some of us are completely fine and comfortable saying, I'll be right most of the time. It's just your clients really aren't. The other thing that I mentioned early on that we want to get to is this confirmation bias. So now we've anchored in, we've got availability heuristic in play, all this adaptive unconsciousness sort of leaning us towards, it's yeast otitis externa, it's yeast otitis externa. And now everything that we do is we are focusing on how to get into this diagnosis, right? So this is great, because the objective facts, we tend to only focus on the things that support our initial diagnosis. And that is where confirmation bias, it really will fail you. And I do try to tell and impress upon my colleagues and my own employees and so forth, the fact that, okay, look, forget the ears for just a second. It's yeast otitis. I give you that. My fear is, do we miss the tumor over here? Do we miss the heart murmur over there, right? Do we miss the loose joint down there? I mean, those are the things I think that really, because we are now focusing consciously and unconsciously on confirming that diagnosis, right? And this is just normal human behavior. As I mentioned before, the adaptive unconsciousness, very, very powerful, taking in 400 billion bits per second of information compared to the 120 bits per second that our conscious mind can do. So it's taking in so much more massive information. And when we start to fall into these traps, wow, it piles on. And suddenly it's like, it's yeast otitis. Go on. It's yeast otitis. You're wasting your time. It's yeast otitis. Come on. right? I mean, that's what we do. Now, another bias that I see quite frequently among my veterinary colleagues, and maybe some of you can relate to this as well, is what we call optimism bias. And honestly, we're dealing with this right now in this pandemic. I mean, many people are thinking, I haven't gotten it so far, therefore I probably won't get it, right? And the optimism bias is actually a really important protection mechanism for human beings, because it is what keeps us moving forward, right? This is why you're able to get on a plane or a train or an automobile, despite knowing that you have a greater chance of dying in an automobile crash than you do sitting on your couch. And so the optimism bias is necessary, but it can become unnecessary when we start to say, I am always right. As clinicians, getting back to vulnerability, getting back to really, being authentic and open and understanding what is motivating and driving us and leading us to make certain decisions. I want us to make sure that we don't just say, hey, you know what? I've been seeing Cocker Spaniels my entire career. I've been doing this since 1992. I've owned clinics since 1993. I know it all. That is really a form of optimism bias that can get us into trouble quickly. So again, now let's jump into, as we kind of get into the last, and again, if you have questions, I'm going to be trusting the CC Animal Health people to put them in that Q&A. Definitely hit us up, however we can get the questions, and then they'll feed them to me. And this is why I really talk about becoming a specialized generalist, because I really want us to focus all of those unconscious and conscious powers that we have into something that we're passionate about, we're good at, and is valuable. And let me explain, okay? Number one, how do you know if you should be a specialist or a generalist? And I get this question a lot. I've gotten this for 20 years for students. I do a lot of work with different students around the country and the world. And, I really started looking at that question years ago, because I am a strong, ardent supporter of generalist medicine. We've already established that from the very beginning. Our legacy is being a generalist, right? I love the power of being able to assimilate lots of information and then focus it on my primary discipline, which is veterinary medicine, but it's really a sub-discipline within veterinary medicine, which we'll discuss in just a second. So here's my advice to students, and I just kind of packaged it up for us today. If you are truly brilliant, and this is a tough one too, because are you really brilliant? There's a lot of people that think they're brilliant, but maybe they're not, and love one specific area, be a specialist. So I get these young students, they're like, I think I'm going to go, I want to do an internship and do a residency. I said, great. Well, so what do you really love? Well, I mean, I don't know yet. I'm going to find that out. Well, wait, when are you going to find that out? Well, probably during my, internship. But like, what's the thing, like, you're really excited about your internship? Like, is it, cancer? Is it surgery? Is it eye, skin, liver? Well, I don't know yet. See, this is where I do believe that in that intrinsic nature of yourself to say, oh, I love this. This is what, of all the things I can do, this is what I super, super love. And people are like, well, I'll find that later. Okay, that may work, and it may work for some people, but really those people that are so driven, like, they went into that first, class on skeletal anatomy, freshman year, and they're like, light bulbs go off, like, this is what I want to do. I recently heard an interview with the rock star Lenny Kravitz, case super, songwriter, hit maker. He's just a fantastic guy. And, he said that at age 13, he went to see, his father took him to see the Jackson 5 concert by the Jackson 5. And he said, as he was watching them, he said he had this moment of clarity. He said, this is what I want to do. And he said from that moment on, all of his energy efforts were put into becoming a singer-songwriter, and of course, the huge megastar that he is today. And like, those are the things, and even my own story, 7 years old, trauma. If you don't know my story, look it up. I've written about it multiple times, but it was born out of trauma. And, that moment on, I'm like, dude, this is what I'm going to do. And everything I did served this journey that led me to here today. So I love those stories for sure. But if you don't find real passion in a few areas of your work, then this is a generalist, right? So those people, they're telling me, I want to go an internship, I want to do a residency, and then I'll figure out what it is. I'm saying, probably ought to be a generalist first. And some of the best specialists I know were people that went into general practice for a couple of years, got completely tuned into some aspect of medicine, just couldn't get enough of it, and then they went back and forwarded their career. So I think those are the success stories I really want to talk about. But again, let's getting back to, you're out there, you're watching this, you're in your own, you've been out here practicing for 5 or 6 years, you're facing a little burnout, you just don't feel like you have a direction or a clear, objective with your career. So what are you going to do? Well, let's say if you're passionate about a few areas of practice, okay? And really, I mean 2 to 3 areas. But, come on, I'm not world-class brilliant. I mean, I'll be the first to admit it. I am, I'm really good generalist. But, there's nothing, I like really 2 or 3 things really, really well. But I'm not going to be like the one who, I'm not going to invent the cure, for cancer or whatever. So I find the 2 or 3 things then. And then what you do is you find the things that are as rare and valuable as possible. Now let's rewind and look at my career and sort of what happened. So, I'm into my career the first really 6 or 7 years. And the first thing that I guess everybody labeled me as like this practice management guru because I had built this clinic from nothing. I was very young. I'm in very, very poor rural North Carolina. And I built this thing up into, multi-million-dollar clinic, yada, yada, yada. And everybody's like, oh, he's business management. And I do. I love management. I love business. I love all of that. But really what turned me on early was longevity. Okay, I would really, and this goes back to my own personal, beliefs around my own personal health and decisions. And so it was really all around longevity. And so when you start to study longevity, you realize, wow, well, nutrition, right? That's why I'm in the pet food business these days. Okay. So you start to realize, okay, nutrition has a lot to do with this, about preventive care. So these are things like lab diagnostics, right? So I wanted to get tests and biomarkers that could help me identify disease earlier and make an intervention earlier to help sidestep and derail and maybe avoid some of the consequences of aging or disease or injury. So, what you do is you find it. Now, think about this, rewind the tape 20, 25 years ago. How many people were talking about obesity in pets, right? Nobody. It was kind of a joke. I mean, you don't want to know how many of my colleagues made fun of me for focusing on obesity. And I was going, hey, this is equal to lifespan, right? This is direct impacts on life expectancy, disease incidence, so some vets would be like, well, whatever, Garfield's a happy cat, he eats pasta. So my point being that I found something that was rare and ultimately was valuable because pet owners they wanted to know about longevity. They didn't like that their dog was crippled at age 6 or 7. And then when they found out, oh gosh, it's from him being 110 pounds as a Labrador, that's a problem. And so this is sort of what leads me to this specialized generalist. And people often refer to this as the T-shaped career. But I kind of want to, I'll show you what a lot of people describe it as, and then I'll kind of do it. Number one, you're deep in one thing. Now, for us, I have to say that's small animal medicine, or it could be large animal medicine, farm animal lab, whatever it is that you're watching from today. But in the veterinary context, it's going to be that deep in the one thing. So, you know what? I went to school, I studied hard, I've practiced. And so when it comes to small animal veterinary medicine, that's where I'm really, really deep. But what I do is I understand and can communicate lots of other things, right? So getting back to business. So my depth was here in vet medicine, but then I had business over here, right? My depth over here was veterinary medicine, but really I was going for longevity, which led me to nutrition, which led me to obesity. And you'll have to excuse me, I am a doctor like most of you, and my writing sucks. Okay, so you get where you're trying to drill down into this. And then we get into this, what the psychologists will call boundary crossing competency. So what are the things that you can do that allow you to connect, your, whether or not it's business, longevity, nutritional, and obesity? Like, are you good at communicating with others? Can you be a critical thinker and solve and spot problems outside of yourself? What can you do to lead others? All of those things start to lead this T career. So right now, wherever you are, you're building on the depth. Okay, the vertical axes of the T, so to speak. But what you've got to do, if you're going to be a specialist in generalized medicine, you're going to have to start to branch out and say, how can I bring in other aspects? Again, 2 or 3 things that you really are passionate about that are rare or valuable, and when that's a combination, it makes it really, really sing, but that's what you're doing. Okay, so what are the requirements as we sort of wrap up and get into some of the questions? Number one, you have to be open-minded. And that's easier said than done. I've already kind of laid out a case for, wow, you know, we really are a young profession. We really have a legacy in general medicine, yet most of us feel completely incompetent when it comes to many of this quote unquote specialist things, yet the specialists have only been around for 70 years or so. So, you know, keep that in mind. Number two, we start to go, oh, wow, okay, there's a lot of cognitive biases going in here. There's this entire unconscious world occurring that I don't know is influencing my decisions in the exam room. It's influencing how I even examine my patients, right? So this open-mindedness leading towards cognitive biases and adaptive unconscious, all of this legacy of hundreds of years, maybe thousands of years, all of this really makes it difficult to become and truly be open-minded. Getting back to that vulnerability aspect I was talking about earlier, like really the vulnerability of a practitioner, of a healing artist, of a doctor, or whatever terminology we want to use today to describe ourselves, is really understanding that, wow, it's very difficult to be truly objective and to be truly open-minded when it comes to my patient care and diagnosis and so forth. You've got to be multiple disciplinary. The reason I fight hard for generalist is because what happens is when you become a specialist, you really focus, and as you should, so intensely on whatever it is your area of expertise is that you start to block out and ignore everything else. We can all probably relate to the story of the person who, with an older, you know, my parents, right? Okay, my father's passed on, my mother, but they go to one specialist, they go to a cardiologist, and then of course she goes to a rheumatologist, and then she goes to an internist, right? And all of them say, okay, so let's say you go to cardiologist, say, but you know, but mom's also having trouble, you know, with urination and her appetite is, and they go, well, that's, you know, that's not really my specialty. And we've all been frustrated there before. They just completely block it out, and you're like, well, wait, I do think the renin-angiotensin system has something to do with the cardiac output. So can we maybe revisit that? But they don't want to. They want you to go visit a nephrologist or urologist, right? I mean, whatever. And I don't like that. I think in terms of patient care, I need somebody there who's the reservoir. And we all can probably relate today to not having that singular collecting point in the human medical system where we go, wow, you know, this person has got all of my information and they're helping me make decisions and guide me. I had that. Dr. Gary Ross was my GP for over 20 years. The man was amazing. He was a saint. He was a fantastic general practitioner. But again, like so many of his generation, he's gone. You know, he has left the profession, and rightfully so. But you know, that was the model I think that served me best, because I had a person who would refer me when necessary. He would take that information, come back, give it to me. You know, we would cogitate over it and say, okay, we should now do this or not do that or whatever. And I want us to, I'm fighting for that. I know many of you are as well. But can you also not only be open-minded and take this multidisciplinary approach, but can you rapidly acquire, you know, the skills? I mean, I think this is the other essence of a good generalist, is to be able to go into something and just dive deep into it. And this is where I talk about flow and creativity and innovation, because now I can just open up, say, okay, I don't know enough about whatever this is. And like early in my career, it was about nutrition, right? So it's like, man, I am going to immerse myself in this, and I'm going to go deep. And I had the ability to get that specialist level skills. And again, that's not in any way a reflection of, you know, yeah, I'm just saying that you have that ability, and you have to be willing then to put in some effort and work. You also have to be able to recognize patterns of behavior from lots of different perspectives, because we're trying to get to universal needs. Again, just leaning on that obesity example, I mean, I realized, man, my pursuit of longevity for pets was going to tie back into nutrition, which then, of course, back-ended right into obesity, which was just robbing pets of life expectancy and well-being, quality of life. And so that was the universal need, right? Quality of life, longevity for pets. And then you just work your way back up the ladder. You really want to find that. I use the term problem spotter and pattern recognition. Like, those are the things I really value most in a generalist, in my own associates and you as colleagues, because can you take an environment and spot the problems, right? Because once we identify the real problems, you know, and there's a lot of low-hanging fruit in every environment, every system, but we're talking about the deep, you know, deep sort of systemic problems that get swept under the rug, so to speak. And can you spot that problem? Can you identify the patterns within the workplace or within the patient or whatever, and then lead me back to saying, here is the problem. I don't know exactly how we're going to solve it yet, but I have identified where the problem is. That is huge. That is so valuable to us. All right. Now let's kind of wrap up today. And where do I think that the big opportunities are? So if you're sitting there watching saying, yeah, Ernie, I get it. I am, I'm halfway, I'm 10 years in. I just don't have the direction and motivation that I think I'm losing the fire for the profession. I'm kind of getting burned out. I'm going to give you a couple of bits of advice. Number one, we talk about rare and valuable behavior. Even though somebody who whispers to dogs has largely tried to take over our domain, we are the domain authorities when it comes to behavior. And so, this is why I'm so happy to be working with people like CC Animal Health, because, they are giving us unique tools, unique science and insight into how dogs' behavior can be modified. So again, if you're out there saying what's rare and valuable, and if you really like behavior, then you need to be exploring things like Calmer Canine and some of the cool research and exciting innovations that CC Animal Health is doing. So again, go to calmercanine.com. You got that. Nutrition. It's not too late. You can help me. We can all work together. I think it's really important for veterinarians to continue to influence and put their voice out there. I mean, that's one of the reasons why when I was given the opportunity to help start a pet food company and it aligned with some of my personal mission and beliefs, oh, wow, you betcha. I was like, yep, sign me up. I'm willing to put in the hard work. And that was the end of 2017. And we're doing great. Wildearth.com. You can check it out and you can learn more about what I'm up to over there. Shameless plug. But, again, it's still opportunity. Your clients want to know what to feed, how to feed, how much to feed, when to feed, all those questions, rare and valuable. And of course, senior care. I've been working hard, founding different organizations over the years, trying to write papers and doing projects around senior care. And then of course, chronic care. I think that, too often we sort of lump these two as these are too general, but I'm going to disagree. I mean, we have gerontologists who specialize in the specific needs of older humans. This is an area for a specialized generalist. So right now, if you really like, as I do, if you like dealing with older dogs and all the little specific needs that come along with a 10-year-old lab, then this is an opportunity. Not only to grow your practice and boost your income, but I think to provide more rewards for you intrinsically. This is what, when I always talk about this word, meaning. What is meaningful to you, right? When I look at this, that's what I'm trying to help you develop. And what gives you meaning may not be on this list. It probably isn't on this list, but I'm always saying, again, what is rare? What is valuable, right? And if I can combine those two, then I've got something. And so I'm always looking for that specialist, generalist approach to that. All right. So again, what does it do? Why is this such a nice thing? It's portable. Because when you have these skills deep in one area, but broad at the top, then you are portable, right? So I can go, as I've done in a now largely corporate setting of a pet food company, or at Vertical Vet, which is our group purchasing organization. I've been able to take those schools. We talked about collaboration and teamwork, ability to lead others. Like those are those other skills that you build on the deep, right? This is what allows you to be truly portable. And I do believe that veterinary practice or veterinary degree is a highly portable, profession if the person has some adjacent skill sets, which is what we're talking about. Again, I want you to be adaptive intellectually. This is what true multiple, disciplinary approach really is. It's being able to think outside of the box, not see that Cocker Spaniel as only an ear problem, but say, hey, I need to check the rest of the integument, right? I need to also listen to that heart. I need to assess the abdomen. I mean, I know that sounds super basic and pedantic, and you're probably going, wow, Ernie, I already do a really thorough exam, but I hope I've made a little bit of a case to show you that there may be some implicit, intrinsic biases that are really probably throttling you back a little bit. And then finally, can you differentiate yourself? We always talk about that in marketing and business advantage. How do you differentiate your product, your services, your brand from something else? And again, I talked about it. If it's behavior, if it's nutrition, if it's senior care, if it's managing chronic conditions, that helps differentiate you in your local immediate market. And so over the years, when I keep talking about, why would you bring in, something like an CC Animal Health? Why would you bring in, a Calmer Canine or the Loops and all these amazing products and innovations that they have? It's because they help you differentiate yourself in the eyes of your public. Okay. And again, differentiation is local. All differentiation is local. So you draw a little 5 mile or whatever mile perimeter is appropriate for the traffic pattern in your area, and you say, who is doing what? Remember, we keep going back to rare and valuable. I'm going to keep coming back on behavior because I think we got a great opportunity. We're just underutilizing it. But also, what about client, complaints about fees? When you have really done the work and you've dug deep and you're passionate about something, you have self-confidence. This helps you segment yourself and differentiate yourself in a given market, which creates unique value. See, this is why, like, I remember years ago, I always struggled. People are like, how can you charge, for these diet consultations? And I could never get my head in that place where I would think it wasn't appropriate. You see what I'm saying? Like, this is a transformational mind shift, and it's absolutely essential for you to reach this next level. So by me coming at it from a completely unique perspective, going, I am valuable. I mean, I've done a lot of work. I've put a tremendous amount of effort and expertise into delivering these nutritional consults. And, I've really worked hard on the science behind this. And I feel completely, justified in charging for those appointments and those follow-up visits. And when you're in that mindset, honestly, it's the most liberating mindset to be in, because you're just like, I can't get where you are. Like, and I used to say this in terms of fitness as well. It's like, when you are in this nearly optimal state of wellness, when you're really at a high level performance, whether it's athletes, whether, especially when I was doing competitive Ironman, it's like, you can't see any other way. And conversely, it's also sometimes hard for me to imagine, wow, Ernie, you used to just go and knock out these 4 and 5 hour bricks just without giving it a thought before you go into work all day. So there's both ways of this, but my point being that it really is the self-confidence thing. When you are a specialized generalist, like, you are confident in yourself. And then here's the other thing. Here's the secret. You then attract people who want what you've got. So for me, early on, as I'm going into this longevity, nutrition, obesity space, people started flocking to me. Clients started coming to me. The Coconut Telegraph lit up, and people said, hey, there's a guy who talks about food. Hey, there's a guy who actually helped my dog lose 20 pounds. Hey, right? So that becomes an entirely different attraction criteria. And that's so important. And it leads to such help and success. All right. So reach for the stars. Today, there was a little bit of 1 or 2 steps on that ladder to the heavens. Here we go to the moon, right? We can go wherever we want. You can go outside of the normal box. And I just want to thank Assisi Animal Health for kind of helping out, and kind of sharing these ideas and thoughts, because, I feel strongly that we just aren't reaching our full potential. And I think that this is one of those steps on that long journey to the stars and beyond that can help you reach your optimal potential.